Hi, everybody. This is David Nevins for Citybiz List. Thank you so much for joining us today. Our guest today is Dr. Ronald Delanois, and he heads the Rubin Institute for Advanced Orthopedics, which is part of LifeBridge Health System. Dr. Delanois, thank you for joining us.
Thank you for having me. I'm excited.
It's really our pleasure. I know the Rubin Institute for Advanced Orthopedics has a world-class team of doctors. Why don't you tell us a little bit about what you and your colleagues do there, and then we'll take it from there.
Absolutely. I want to first emphasize that the Rubin Institute does do some very unique things, which I'll mention. But what most importantly is we take care of everyone, right? We don't just take care of the specialty things. Sometimes you'll go to certain facilities for very special problems. We have that capability in orthopedics, but we're very proud of the fact that we can take care of everyone from birth to the end. So some of the things that make us very unique, though, is that we have some divisions that are world renowned. Our joint division, the arthroplasty division, has some of the most published, most leading orthopedic surgeons who are literally carving the path for the future in arthroplasty, which we're excited about. And then something that is near and dear to my heart is our International Center for Limb Lengthening, which is a division that was started 20 years ago. One of the founding fathers is still with us, Dr. John Herzenberg. He has a great team with two other individuals there in pediatrics and some adult colleagues such as Michael Asiag. And these guys really focus on patients who have some unique issues in orthopedics, things that most places in the country don't take care of, and we can. And we actually do things that are you may think is kind of odd, but there still is a need, which is stature lengthening. As you're probably well aware, in some parts of the country or in parts of the world so much, there are places where height matters, right? And when you're not a certain height, that's potentially a detriment to your career. So these individuals will seek us out for what we call cosmetic stature lengthening. And I don't want to downgrade it, think it's cosmetic, like it's some of the things that are currently marketed. This is really helping and changing people's lives because it makes them feel psychologically better and, more importantly, socially more accepted. So we do that as well. So I could go into details in terms of what they do, but really what they offer is just very unique as it pertains to what's different from the rest of Maryland and actually the East Coast.
I know, Ron, that the Rubin Institute, it's easy to say, but it is truly world renowned. And you just mentioned a piece of it. I know that you are in particular, as a very prominent orthopedic surgeon, you are in particular interested in, we're all familiar with, and particularly as we age, we're all familiar with joint replacement surgery. And so I'd like you to talk a little bit about that. But more importantly, you are promoting something known as joint preservation.
Yeah.
So it strikes me that if one has the opportunity to preserve their joints, that's probably a bit better than having to replace their joints. But
yeah, absolutely.
I'll let you, as the expert, comment on that.
Yeah, you would think that that's a competing or a conflict of interest, right? Where here we are, surgeons, we replace joints, but yet our focus is how do we preserve joints from replacement? So the International Center for Joint Preservation, which is what the other arm other than the ICLL is, has really had a huge focus on joint preservation because we do believe that if we can preserve your joint, that's better than any artificial joint that's out there. So we have invested a tremendous amount of research, and we currently have 4 research projects currently ongoing that are very innovative in trying to preserve joints. One of my personal favorites is we're offering patients, what's called PRP. PRP stands for plasma-rich protein. People have heard about it. It's a fee for service for most individuals, meaning the cost can be fairly high and not accessible to a lot of individuals. We at the Rubin Institute are offering that service for qualified people who are willing to participate in a study that service for free because we want to understand how to make it better. How do we make not just your pain better, but maybe even restore your joints? We have some studies that are so unique. We have cells that have been altered. We have through an injection, those cells are implanted into the knee. And the purpose of those cells is to produce certain proteins that's cartilage protecting. That's revolutionary. That can literally change the direction of arthroplasty. 10 years ago, we used to say that the number of knee replacements are going to triple in this country, right? And that trajectory continues to be on path by 2030. We think that with this technology, we can curb that. Not everyone needs to or should get a joint replacement. As good as they are, not everyone has a tremendous success, and they are associated with complications. And so this is a way to potentially change that path. So we're very excited about those opportunities, specifically for research. And I'm very proud of the fact that we are the only ones doing these types of studies in the state because they're considered phase 1 and phase 2 studies. We have a multitude of these osteoarthritis studies trying to change the path or improve the quality of the patient as it pertains to their ability to ambulate, to get around and walk.
So, Dr. Delanois, let's take this opportunity. I think there are tens of thousands of people who will see this interview. Talk a little bit more about some of these research studies that you have taking place. And I think it's always a fascinating thing to have the opportunity to participate in one, not just for the benefit of getting zero cost medical care, but really
it's to make it better.
It's to make you better and to have the opportunity to advance medicine and have played a small role in that. So if you don't mind just getting a little more specific in that regard, and how do people find out about these studies? What are they in particular, and how can they participate?
So, not to belabor the point in terms of how many studies, but we currently have 4 active studies right now looking at how to manage osteoarthritis. So a couple of them are actually trying to change the path by altering the cells and altering the environment of the knee so that people's knees don't degrade as quickly. That's exciting. I mean, that is revolutionary. We have other studies that look at how to better manage pain so that people don't need an arthroplasty as quickly. Because our conventional management of osteoarthritis has been the physical therapy, injections, medications. When those fail, we offer surgical intervention. We offer a joint replacement, knee replacement, hip replacement. Wouldn't it be nice if we could offer you a plethora of opportunities that could potentially offset the need for a replacement? So, we again, not to tell you in detail of all the studies, but they're all, you may have heard the expression stem cells. Stem cells are, it's kind of gained a tremendous amount of momentum. They're utilized for cancer therapy. Immunotherapy is something that people hear about in cancer therapy. It's all based on altering the genetics of a cell and then putting it back into the body and having it do something different than it originally did. This is what we're doing now in orthopedics. We're putting in different types of things inside the joint and hoping and watching to see if it's going to alter the environment and preserve that joint. That's what the studies are about. As you can probably tell from my tone, I'm extremely excited and passionate about it. We need more of this in the orthopedic literature and in the orthopedic community. And just to say something, I belong to the American Academy of Hip and Knee Surgeons. They did a symposium on non-operative management. They looked at, there were 1,200 abstracts at this symposium. And our research on non-operative, non-surgical management of osteoarthritis was one that was featured because there were only, I think, 4 abstracts looking at the management of osteoarthritis non-surgically. I mean, that tells you, we are doing it differently. We're attacking the problem very differently than our colleagues. And we're proud of that.
And I know, Dr. Delanois, the advances in technology have played a role in that too. And you all at the Rubin Institute are at the forefront in that regard as well, correct?
Absolutely. We are not only focusing on non-surgical. I mean, obviously, until we get there, we have what I like to say is the latest and greatest. We have robotic technology that is different than what is currently marketed. The robotic technology that we offer doesn't require a CT scan, which in my mind is extremely exciting, because when we think about healthcare costs and healthcare expenditure, which is always in the forefront of the news and in the government, and it's a significant portion of our overall spending in this country. How do we curb that? How do us as physicians employ technology, but at the same time curb the cost? And these types of technologies will do that. We're excited about that. So yes, we are doing things that are very innovative and different. And I'm very proud of the fact that in my division of the International Center for Limb Lengthening, they've helped develop a growing nail. You're saying, what's a growing nail, Ron? So let's assume, and this happens, right? Their one leg is shorter than the other leg from trauma, from birth, from whatever it is, leg, thigh, arm. These guys developed the growing nail, or helped develop the growing nail in partnership with a vendor, and they're able to put this nail into the legs, cut the bone, and without having any devices outside the body, cause that nail to expand, and through old techniques but newly employed, grow the bone. And they can grow the bone 2 inches, which can give people that opportunity we discussed earlier. And so, we're excited about that. We are extremely innovative on all fronts, surgical and non-surgical.
It's all quite fascinating. And I know, based on my knowledge of your organization, that the Rubin Institute, as I mentioned earlier, is truly renowned, and not just throughout Maryland, and not just
you're too kind.
Not just throughout the country. But Dr. Delanois, before I let you go, I know you guys, you and your colleagues, are just as passionate about your mission work around the world. So I just share with us a little bit about that, and how that came to be, and what that means to you and your colleagues at the Rubin Institute.
I have to credit one of my senior partners, Dr. John Hertzberg. He's really been the one who's been the most passionate. We have everyone who's done a little bit, but Dr. John Hertzberg, Sean Standard, Phil McClure, they've taken it to a new level. John just came back from Liberia. Liberia, a country that is beyond poor, providing services that they would never, ever see again, because there was a need, for free. Right? He brings his entire portfolio with him. He does it with a skeleton crew at minimal cost to provide good quality care to people who have absolutely zero access. I mean, that's what it's about. Healthcare, being a physician, is about taking care of people. People have lost track, and overall, there's been a certain aspect of medicine that has evolved into something different. But the core of what medicine is, it's me and you. It's the doctor and it's the patient trying to work together to solve a problem. And that problem is whatever that health issue is. And some people have no access. And we want to, my guys, including myself, because I've gone as well. I've gone to Haiti to provide services, and I want to go back, is to provide services to places that have really, it's not because they don't want it, it's because they have no access. The infrastructure doesn't support it, but we can come there and we can help them out. And, I have to say, the person I'm most proud of is Dr. John Hertzberg and his wife, because that was something that was very fundamental to the Rubin Institute, was giving back. And they've done that in spades. Very proud of that.
Well, terrific. I mean, kudos to you, kudos to them, and keep up the fine work. Dr. Delanois, how does someone learn more about the Rubin?
It's the infamous internet, right? I mean, you can call us at 410-601-BONE or 410-601-WELL. or just if you're not sure, you can look up LifeBridge Health Orthopedics and the Rubin Institute. I think the Rubin Institute is probably easier. If you look up the Rubin Institute on the internet, you'll find us. We have them there. There's no hard way it's not hard. We're there if you look. I can give you our numbers, but the reality is, if you're interested and you want to learn more about what we have to offer, which is different than what everyone else is offering, then come and find us. Come and see us. We're happy to see you. We're happy to take care of you. And we're happy to offer you things that you may not be exposed to where you're currently located.
Dr. Delanois, truly a fascinating conversation. I have no doubt that our viewers will respond in significant numbers. And I'm particularly interested, and we'll follow up. We've all heard about joint replacement, but joint preservation, it seems to me, if you start that early enough, that's a win.
My goal. I mean, listen, I'm getting older, getting closer to that point where I need my work done as well. And it's interesting, when you're young, you think old is 55. And then you get closer to 55 and 70 becomes old. And then you get older and you're like, no, that's not old yet, right? Because then you're like, I'm not ready to slow down. I don't want to be that person. And I get it. What I'm very proud of is that people want to keep moving. People want to stay active. And we want to help them do that. And we want to help them do that ideally with their own joints. And if they can't, with the latest and greatest replacements.
Ron, thanks so much for joining us today.
Thanks, David. Appreciate it.
Our guest today has been Dr. Ron Delanois. He heads the Rubin Institute for Advanced Orthopedics, a part of LifeBridge Health System. Reach out to them to learn more. Thank you so much for joining us. This has been David Nevins for Citybiz.
Thanks, David. Have a great day.